experts are uncertain how long this pandemic will last and the effect that it will have on their businesses. Nonetheless, food and environmental companies must be prepared for the safe return of their employees and can take actionable steps now in their environmental monitoring programs to do so. Today, we will cover best practices on how to address and test the SARS-CoV-2 virus in the workplace, with guidance on processes and controls to implement. We will also share insights from you based on the survey that we conducted a few weeks ago. Please feel free to submit questions throughout the webinar by clicking on the circle with a question mark on the right-hand side of your screen. We will save about 10 minutes at the end to go over all the questions. If we don't get to your question, don't worry, because we'll collect them all at the end and send out an email after the webinar with some answers. Our two speakers today are Dr. Florence Wu and Tom Sidebottom. Florence is the founder and president of Amtech. She has extensive experience in pathogen detection and analytical method development, food safety sampling strategies, microbial contamination control, food safety training and consulting, and environmental monitoring programs. Florence has over 30 years academic and analytical experience in mycology and microbiology, and over 17 years of managing an independent contract laboratory. Tom is the new executive vice president at Amtech. Tom came to us after his 11 years of managing a California FDA laboratory. He has 32 years of public health experience with the US FDA in testing, inspection and enforcement of federal safety and sanitation standards, developing scientific testing protocols to verify controls and validation of food safety programs, and developing novel approaches to meet regulatory standards. The webinar today is being brought to you by Amtech. Amtech is an accredited laboratory in the San Francisco Bay Area, specializing in microbiology testing for environmental health, food safety, and water quality. We serve environmental consultants, industrial hygienists, food and product manufacturers, and municipal water suppliers. With that, let's get started. Florence?
Thank you, Jessica. Hi, everyone. Welcome to Amtech's webinar on environmental testing of COVID-19 virus. I'm Florence Wu, and I'm so happy to have this opportunity to connect with you. The idea of having this webinar was from our desire to help our clients. I don't believe anyone had prepared for the pandemic in the beginning of the year. We are all forced to deal with it after it arrived. We wanted to know how our client and the industry professionals handle this, so we conducted a survey in late April. About 50% of the responses are from food industry, nearly 30% from environmental consultants and industrial hygienists, and 20% from other industries. Among the companies that responded, more than 90% said that they remained operational during the shelter-in-place order, and that they encountered some challenges. The main challenges are obtaining and keeping supply of personal protective equipment and sanitizers, meeting social distancing requirements due to space limitations, keeping employees safe at work, and dealing with employee absence and illness. Some companies suffered lost demand and declined sales. Others had seen supply interruptions. However, when asked, should your environmental monitoring program include COVID-19 testing, the answers are nearly divided in half. Still, more than 90% responses indicated that they are interested in attending our webinar about environmental testing of COVID-19. This is very encouraging. So here we are having this webinar, and thank you again for joining us. We organized today's presentation into 5 sections. I will first review the basic definitions of coronavirus and how it spreads. Then Tom will summarize best practices in controlling COVID-19 in workplace and the recommended effective cleaning and disinfection practices. In the last section, I will introduce our sampling and testing method for COVID-19 virus. COVID-19 stands for Coronavirus Disease Outbreak in 2019. It started as an epidemic in China, then turned into a pandemic affecting many countries globally. Coronavirus are a large family of viruses which may cause illness in animals and humans. In humans, several coronaviruses are known to cause respiratory infection ranging from the common cold to more severe diseases such as MERS and SARS. The coronavirus that caused the COVID-19 is named Severe Acute Respiratory Syndrome Coronavirus 2, in short, SARS-CoV-2. Public health agencies have done a great job in educating us about the symptoms of COVID-19 infection, as listed here. If necessary, people can use CDC's self-checker to get an idea whether they should call a doctor or not. By now, you have probably seen many different versions of coronavirus illustrations, and know that the key structure of coronavirus is the spike protein on the outer edge of the virus particle that gives the coronavirus their name. This structure can be observed using electron microscope, as shown here. When coronavirus infects human cell, the spike protein binds to the ACE receptor to human cells, release its RNA, and use human cell content to manufacture many more virus particles. It is a very efficient process from the virus standpoint. The COVID-19 virus had a specific spike protein structure that allows it to bind at least 10 times more tightly than the corresponding spike protein of SARS to their common host receptor. This means that the best defense for us is to stay away from the virus. Because of its high infection rate, COVID-19 spread much faster than SARS. That brings us to the next topic. How does coronavirus spread? COVID-19 virus is primarily spread from person to person through small droplets, aerosols, and surface contact. Small droplets are released from the nose or the mouth through coughing, sneezing, or speaking. People may become infected with COVID-19 if they breathe in the droplets from a person infected with the virus. Aerosols are smaller than droplets. Respiratory aerosols containing the virus can hang in the air for longer periods and can be breathed in by those standing nearby, therefore transmitting the virus. Surface contact is by droplets from the infected person that can settle on surface. People can become infected by touching those surfaces, then touching their face. It is possible when the virus main infectivity on the surface. I would like to use this case study to demonstrate that SARS-CoV-2 transmission through droplet, aerosols, and surface contact. In this study, surface swab and air samples were collected in an ICU unit in the general wards in a hospital that treated COVID-19 patients in Wuhan, China in February and tested using real-time PCR method. Almost all positive results were concentrated in the contaminated areas. The rate of positive samples was much higher for the ACU than for the general wards. The rate of positive samples were relatively high for floor samples, perhaps because the gravity and airflow causing most various droplets settled to the ground. In addition, as medical staff walk around in the ward, the virus can be tracked all over the floor, as indicated by the 100% rate of positivity from the floor samples, mostly found in the pharmacy, where there was no patients. Furthermore, half of the samples from the soles of the ICU medical staff shoes tested positive. They further assessed the risk of aerosol transmission of the virus. They found that 35% of ICU air samples were positive. This result confirmed that SARS-CoV-2 aerosol exposure posed risk. The exposure risk was also present in upstream area, and the maximum transmission distance of SARS-CoV-2 aerosols might be 4 meters, and that is 13 feet. The rate of positive samples was also relatively high for the surface of the object that were frequently touched by medical staff or the patients. The highest rate were for computer mice, followed by trash can, handrails, and doorknobs. Different studies show that coronavirus can retain infectivity on surface anywhere from minutes to days, depending on the type of surface, as shown in this table. For example, on the metal surface, coronavirus can live up to 5 days. On cardboard surface, coronavirus can live up to 24 hours. COVID-19 was not yet recognized in December 2019. Now the virus has become the most potent natural killer since the Spanish flu pandemic. As of yesterday, there are over 7 million confirmed cases worldwide, over 400,000 deaths, and still thousands of people lost their lives due to the disease every day. Unfortunately, this shows that we did not learn from history. As you can see from this chart, during the 1918 flu pandemic, acting early was essential to reduce the rate of death. St. Louis managed to flatten their curve, while Philadelphia still held a parade 2 weeks after their first cases and took them much longer to take social distancing action. The outcome are very different. Delaying action led to disastrous results. While the COVID-19 pandemic is still here, the country is reopening. We are seeing new coronavirus spikes in many states. The challenges we faced to remain operational during shelter-in-place order can potentially become bigger. That is, keep COVID-19 out of our workforce as the country reopens. And that is Tom's topic. Here's Tom.
Thank you, Florence. Good morning, good afternoon. Thank you for taking the time out today as I continue the webinar into the next 2 sections for our topic today. I'll be covering sections 3 and 4 about control and cleaning and disinfecting of the facility. For those of you that have been open and working during the current pandemic, this next slide in terms for guidance in preparing your workplaces for COVID-19 is familiar to you. If you're not already familiar with this, I'd like to just take a moment to walk you through this excellent guide that CDC has on their website. And starting on the left, the first column starts you with, should you consider opening? Followed by the middle column are your recommended health and action plans in place for COVID-19, and it walks you through a series of questions and process to get to a yes or no. And then the last is there ongoing monitoring in the workplace, and walk you through that step. Again, if you've been in a shelter in place or been in operation, these are very familiar. However, it's not just CDC requirements that you have to comply with. On other federal and state and county health orders also include other requirements as we go through. If you're not familiar with this process because you're reopening after a shutdown period, I will attempt to flag critical points throughout the next section, but remember, this information is available to you on the website. Before I jump into this section, I'd like to just go back and reflect on the survey results. And certainly 3/4 of you out there responded that you're concerned about COVID-19 in your workplace. And then when asked, is your company prepared? A resounding number said 77% said they were prepared if there was to be a positive COVID-19 case in their facility. However, there's a 23% that either aren't prepared or perhaps maybe not prepared as you could be. So as we look through this next section, we're going to look at identifying simple steps and tools that will help you reduce the concerns of COVID-19 spread and raise your preparedness level in case this happens in your facility. What are the steps to reducing the risk of worker exposure to SARS? Well, Florence has already covered quite an extensive process by the droplets being transmitted person to person, hand contact, and different surfaces. But when we look at our facilities, there are several steps that we need to go through. And this is probably the most important or critical step, is to evaluate the risk. Not just the risk of your facility, the risk of your employees, the risk of your processes, both operationally and administratively. It takes putting together a thorough risk assessment. And what do I mean by thorough? These might be some of the questions you ask. What are the risks of COVID-19? Well, today's webinar is providing you education and information about the spread and information you can use in risk evaluation. Where might those risks occur? How often might the risks occur? What controls do I need to have in place? What contingency plans for employees and operations do I need to consider? Do I need to include commute distances for my employees or transportation sources for my business and how my employees come and go from the facility? What do I need to do to prevent disruptions? For example, you may be operating under a single long day operation shift, and perhaps you want to consider moving that to a 2-shift activity so that you can isolate and your employees so that not everybody goes out at one time should you come down with a COVID-19. You may have seen on the news where some food facilities have had to close down because of a situation like this. Ask your team, what else might we need to consider? Don't just rely on a few questions and the obvious things that you need to, and be thinking overall about your contingency activities through this process. I'd like to walk you through hierarchies of control. This is a great tool that'll provide you a way on how to implement feasible and effective control solutions applied to COVID-19. Now, this hierarchy of controls has been around for a number of years and was developed by CDC NIOSH, and is a tool really developed for means for controlling hazards, workplace hazards and chemicals in operations. But I'd like to walk you through this hierarchy just to orient you to the inverted triangle that you see in front of you. The triangle takes you from the blue region of the most effective controls down to the red region for the least effective controls. So as we look at the top, the most effective is elimination. So on elimination under COVID-19 would be shelter in place. That removes you from the hazard. A substitution activity is something that replaces the hazard. So where we were used to face-to-face meetings, conferences, webinars such as this, we now use Zoom and other web technologies to video conference in place of face-to-face. Engineering controls. These can be physical barriers. These can be ventilation and HVAC controls. These can also be disinfectants, things that are going to disrupt the environment physically. Next is administrative controls. These really are focusing on ways to change the way your operations and the way people work in your facilities. Certainly your isolation and response policies are going to cover this administrative control, and we'll talk a little more about that in a few minutes. Personal protective equipment. Now this is really PPE, and you've heard that term, but this particular area might refer to if you're in a hospital, clinical setting, where you need to wear an N95 respirator or face shield or other PPE, gloves and masks and so forth to prevent the hazard from affecting you. Let's move on to the next section on administrative controls. These include good hygiene practices, monitoring workflow patterns, break and lunch schedules to optimize social distancing. Take the time to evaluate all areas. Remember your risk planning activities. What risks do I need to minimize or control? Examples might be visitors. When visitors come into your facility, and visitors could be customers coming in, it could be service technicians coming in to work on equipment in your facility. Do you require them to wear a mask, put on gloves, safety glasses? Do you sanitize their equipment and tools they're bringing into the environment? Do you ask them questions? Perhaps you've implemented a questionnaire and a temperature monitoring before you bring them in so that you've controlled the risk that's coming from the outside into your facility. Another type of administrative control might be in your workflow process, you have a doorway passage that allows in and out activities. Perhaps you look at changing your workflow to a single direction and make that a one-way door so that, again, if you have a case where you need to go back and sanitize or clean your area, you can minimize access points and interactions between staff through those access points. Perhaps adding more sanitizing stations, removing shared water coolers are but a few of things that you can do in your facility. Again, look around at the common things and look at the risks that are presented there. In social distancing in the workplace, there's different ways to do that. Perhaps in your break room or lunch room, it's designating shifts to certain areas and also removing the number of chairs or seats available so that you maintain the appropriate distance. Now moving on to the next section, and by far, I think this section is really critical in your planning activities for controlling coronavirus in your workplace. And these are your policies and procedures that really form the basis of your communication plan. They're the most challenging because you have to consider not just your process, not just your operation, but you have to consider your health ordinances and laws that might be in effect. You have HIPAA requirements. You have to think about the impact of an event to your staff, to any visitors you may have in your facility. And you need to think about what are your monitoring activities and what are your communication activities. I can't stress enough that while you're developing your policies and procedures, that you be clear with your lines of communication. Be clear with your communication, both verbally and in email. Be clear with responsibilities for both you as an employer as well as for your employees. And why are these steps important? Because if you have a situation or event that you have to respond to, these pre-planning activities will help you to lower the stress and anxiety by communicating clearly, concisely about what you know and what you don't know. Here are some helpful questions that you might want to ask in this process. What are the responsibilities as an employer? What are employee responsibilities? How am I going to communicate internally with my staff? How am I going to communicate with visitors? Do I need to notify the health department, and if so, when? Be prepared and plan ahead. Don't wait for your first activity to be a phone call that someone just tested positive for SARS-CoV-2. Even if you followed other control steps up to this point, do not neglect this step. Now I'd like to work into engineering controls. These engineering controls are really designed to decrease exposure time or reduce the concentration of the virus. Again, if you go back to Florence's earlier section about how the virus is transmitted, these are ways to disrupt the virus or reduce the impact on person-to-person contact. What's best for your operation? These engineering controls need to make sense and be practical for your business activities. If you're interacting directly with customers, there are social considerations to consider. Some of these engineering controls can be challenging or costly depending on the environment they're applied in. Again, look at your risk to determine what you need to provide and focus. Sometimes an administrative control can be a much cheaper alternative to perhaps developing an environmental control. For example, I'd like to share with you, my son works for a structural engineering firm in San Francisco, which has a number of offices in California. As a result of COVID-19 and shelter in place, their offices shut down and sent everybody to work from home. Recently, many of the offices were ready to open, but in preparation for opening, they had to evaluate their risks. They set up physical barriers, they reconfigured their office layouts so that they could minimize those risks. All the offices in California reopened except for the one in San Francisco. Why? Well, while the engineering controls that they put in place for other offices were effective and the administrative controls, one of the controls or challenges they faced was looking at the staff and where the staff commuted from. And it turns out that 16 of almost 20 staff actually took public transportation to get to the office. So they realized that there were no immediate controls they could put in place without thinking a little bit more about how they might minimize the risk. And so they're currently working through those controls to determine when they can bring staff back to that office. So if you look at the engineering controls and the things that are there, you can look at both physical barriers, you can look at HVAC and others to help you navigate, again, what is best for your environment and the risk you're trying to work on. Now I'd like to switch into the disinfecting and cleaning your facility. So if you've learned about the virus and understand how it spreads, if you know the risks and understand how to reduce the exposure, then knowing how to remove it from your environment becomes the next critical step. I would like you to think about cleaning and disinfecting in a different way than you may normally think about routine sanitation. If you recall from Florence's description about the virus, do you remember the envelope or the coat on the exterior? That exterior shell protects the virus. However, effective cleaning and disinfecting in your facility will rupture the protective coat and thus disrupt the spread of virus in your facility. Now, as we move through, I'd like to cover what and how to clean, when, what cleaning methods to use, and how do you know is it clean? How is it clean enough? As you review these steps and we think through the next slides, I'd like you to focus on your cleaning strategies from two perspectives. One is look at your preventative strategies, not just the routine sanitation and cleaning that you do, but also include the additional steps to account for the engineering controls, administrative controls, and other things you might have added specifically to your routine activities that will need to be cleaned and sanitized on a recurring basis. Secondly, I'd like you to focus on your cleaning strategies in response to an event. What do I need to do after something happens? What cleaning and disinfecting steps do I need to do to implement when there has been a potential or a confirmed exposure to Corona-19 in my facility? What do we clean? Well, these are obvious areas that we think about on a regular basis that are cleaned in your facility. Frequently touched surfaces, I think, is a tricky one, and we're going to spend some time, as you saw in Florence's slide, and talked about the amount of time periods and different surfaces that the virus can survive on. It's important that we spend a little bit of time discussing frequently touched surfaces. What do frequently touched surfaces mean to you? We all have different ideas, different things we think about. We have things that are different familiarities to us as we move through the environment. Some things we recall, other things we don't. However, what I'd like you to do is be thinking about what you need to clean and do to sufficiently remove the virus from these frequently touched surfaces. There is a lot of information available from CDC and others if you need to reference those as part of the virus and how to handle that in your environment. As we walk through the cleaning process, I'd like to challenge you with a question. And the question might be something that you did today or yesterday or in the past couple of days, but I'd like you to think back to the last time you left your house to go to the store. Before you left your house, got in the car, and before you arrived at the store, can you think back about how many frequently touched surfaces did you touch at your house, in your car, even before you set foot in there? Can you recall all of those areas? Are you sure you covered everything? Could you verify that you didn't miss one? For me, a number of frequently touched surfaces sometimes means that I'm doing things subconsciously and can't recall the steps that I do. However, as my wife might remind me, when I get in the car, when she gets in the car after me, she realizes I've changed the radio station and I didn't change it back. So again, I don't think to do something that's familiar to me. But in this situation, I think having another set of eyes and ears and confirming those steps may be important. And again, for the familiarity of your facility, think about these areas, walk through those spaces, identify them, look at your number of employees, your square footage, your floor plan, your traffic patterns, how visitors come and go in the facility, and think about all of the extra hand sanitizers and barriers that you put in place and when they need to be cleaned. Also, as you develop this list and you look at the frequency, and this is really based on risk, look at the different methods that you're using to clean. And in the pictures I'm providing here, there's a couple different methods to use, from spraying to hand wiping. You can use disposable wipes, and then there are fogger or spraying applications and sanitizers that work effectively. Again, if you're handling an aircraft, that's a much different environment than perhaps you're handling a work surface in your location. We can talk about other things that we put in place in our facility, like the barriers, flat surfaces, counters, desks. Those are very obvious. But what about face shields? What about your safety glasses? What about gloves, particularly if you're wearing cloth-based gloves? Are they getting laundered on a regular basis? Same with cloth face masks. What about your receiving or marshaling areas for x-ray scanners, magnetometers, frequently touched screens, other shared computer kiosks, service entrances, things like that? Are you evaluating your in and outgoing areas, your packages, people, mail, making sure that they're following the practices and the things, and making sure you're cleaning those areas if they're throughout the day? Now, you can feel a little bit like you're traveling through a maze. However, when we look at when to clean, if we've established our policies and procedures, we understand how the virus is transmitted, we're using the right methods and approaches for doing that, then we can build on these activities as we're planning the practical steps and when to reopen. As you remember, I talked about preventative strategies and response strategies. So if we look at things we do before we reopen, so if you're a business that's now reopening for the first time, there are things you will need to consider and do that first time before reopening. If you're focusing on reopening after a shutdown, then you're walking through looking at all of the areas and spaces. Again, you can look at things between shifts or work cycles. after major service events, including maybe services on your HVAC and other systems in your facility. And look through and consider things like photocopiers, printers, other things that may be serviced or used, and your physical barriers that you implemented in your location. When we talk about the methods, we talk about what kind of disinfectants and products. I'm sure there's a number of questions. Am I using the right materials? Things like that, and these may come up in the questions. However, there are excellent resources from both CDC and EPA on what are effective for addressing COVID-19 and SARS-CoV-2. I certainly am not an authority on all of these different cleaning surfaces, but important here is looking at your materials that you're using. You need to consider the surface material, or what's the makeup of the contact surface that you might be cleaning. What concentration of the solution do you need to use, and what application do you need to be effective? And I would suggest that when hard to clean areas, that you're looking at fogging or spraying activities, but again, you need to look at what's the risk that you're trying to control, what's the right chemical to use, and is this something I have to wipe down or allow to air dry on this, and do I need to take other safety precautions when I'm applying these chemicals in my location? Again, I point you to the EPA and the CDC guidance for more information. Now, as we end our time on this topic, and before I pass the communication back over to Florence, I kind of come back to the survey, and 55% of the respondents indicated that environmental plans should include COVID-19 testing. But when asked if their sampling plans had changed or updated, only 25% had made any adjustments to their plans. So as I think about this, I'm speaking perhaps maybe to the other 75% of you that are out there, and perhaps maybe a small percentage that is, you think about what have you changed, are you considering the right changes in your location? And I'd like to share an illustration from my passion and background in entomology from the world of honeybees, and to illustrate the parallel of health and safety activities of a beehive with those we've been discussing today. In a beehive, every activity has a purpose. It's efficient, it's constantly being monitored, it's tracking what's coming in and what's going out, the pollen collection, the honey collection, the health of the hive, the safety of the hive. It's always cleaning the hive, and importantly, they are constantly scanning and monitoring for hazards and risks. Every member has a well understood role and responsibility, and when there is a risk or a threat to the hive, they have an integrated communication protocol and activities ready to go to respond. After an event, they verify that the environment is safe, they communicate, and they actively return back to normal activities, routine activities after that event. In case you got distracted while thinking about bees and honey, let me dial you back to the points here are: be prepared, evaluate and monitor your facility for COVID-19 risks, have an integrated communication plan, initiate your response plans, and verify your action steps for controlling COVID-19 before resuming regular activities. So I leave you with this final question: in your beehive community of your business environment, what environmental steps am I missing or need to include in my business environmental plan to respond to COVID-19? And with that, I thank you and pass the mic back to Florence.
Thank you, Tom. Now I would like to discuss environmental testing of COVID-19 virus. I would like to cover 5 topics in this section. That includes the purpose of testing, proper sampling method, our testing method, guidelines for result interpretation, and recommended follow-up actions. So why would you perform environmental testing for COVID-19? I think that the main reason for sampling virus during this pandemic is similar to sampling after sewage cleanup or remediation after a contamination event. That is, to verify if cleanup or remediation is effective. Virus is its own group. It is outside of a tree of life, so there's no direct indicators. Sampling is a good measure to monitor the environment as part of the environmental monitoring program. A positive result warrants more frequent sanitation, perhaps screening tests of workers, and that can potentially prevent the spread of the virus. Let's say you decide to do sampling. You will need to have special sampling kit. The kit that we prepared for you including these items: a vial containing inactivation and transport medium, specialty swab for virus sampling, alcohol pad, gloves, and a pouch to protect the vial. The process is rather simple. First, you need to moisten the swab with various transport medium. Then use the swab to sample surface, similar to what you would do in the environmental monitoring program sampling. Then store the swab tip in the transport medium, disinfecting outside of the vial with the alcohol pad, and then wipe clean the sampled surface. The process is rather simple. In my opinion, the only tricky part is to break the swab handle and the break point to release the swab tip into the vial. Afterward, follow common practice of packaging and shipping microbiological samples. That is, keep the samples in an insulated cooler with ice and ship overnight to also avoid extreme temperature. So where you want to sample? As the case study has shown, high-task areas pose contamination risk. So I would focus on sampling these areas, which include computer, keyboard, mouse, handrails, doorknobs, electronic panel, cards, and high traffic areas such as restrooms, lobby, appliances, and furniture in break room, and a high traffic area. Think the seek and destroy mindset you have for environmental monitoring program. For testing, we use real-time reverse transcription PCR technology, which is a CDC method. And the testing and control primer and probe site are also from CDC panel. 2 SARS-CoV-2 nucleocapsid gene markers are targeted. When it's called gene 1 and N1 and N2. Here is an example of how the results will be reported. The test is a presence-absence test. The results are expressed as detect versus non-detected for the 2 markers N1 and N2. When both markers are non-detect, the result is negative, which means that the virus is not present. If either or both SARS-CoV-2 markers are detected, the sample is considered SARS-CoV-2 positive. The method is validated internally. There is a limitation of this testing method, and that applies to the PCR method itself. And that is, the positive result does not indicate if the virus has infectivity. To know if the virus is alive per se, and if it can infect people, cell culture method has to be used to determine it. If you receive negative results from COVID-19 testing, then continue sanitize and monitoring. If the result is positive, then consider take one or more of these actions. Perform targeted sanitation and retest. Consider screen testing employees that are exposed to the area. Really evaluate environmental control measures to find out if any gaps exist. Increase sanitation frequency or locations. And continue sanitizing and monitoring. Thank you all for attending today's webinar. You have been a wonderful audience. Now we have time for a few questions, and Jessica will take the questions.
One of the questions that we received was, what are the potential risks for the person who performs environmental sampling? Florence, did you want to take that one?
Yes, that's a good question. I think the potential risk for the person who performs environmental sampling is really depends on the environment that he or she is sampling. For example, the hospitals that treating COVID-19 patients would have a much higher risk than, say, a food manufacturing environment and after sanitation. We recommend using the environmental sampling as a tool to verify the effectiveness of disinfection. So the environment should have been sanitized before the sampling. The swabbing itself does not elevate the risk because the virus transport medium can also deactivate the virus as soon as you moisten the swab in the liquid. Anyway, regardless what the environment, you should always wear proper PPE, which including mask, face shield, protection glasses, disposable gloves, and in other environment or high-risk environment, you probably consider even higher grade of protection here.
Great, and that kind of actually leads into another question that we had come in, which was, what does the vial have in it that inactivates the virus? And do we provide them?
It's a special liquid. Again, it has have an extraction medium that they extract RNA out of virus. So the virus itself will be fixed per se as soon as it hits the liquid, and the liquid also preserved RNA to maintain it, so the lab can detect it.
And we do provide those as part of our sampling kit.
Right. The liquid, the little vial is preloaded with the transport medium.
Great. Here's one that came through while Tom was talking. How would you recommend best communicating with employees regarding hygienic practices and personal protective equipment?
What an excellent question. Thank you, Jessica. Thinking back to section 3 of the webinar, I would order things in this manner. Build in your hygiene practices and your personal protective equipment requirements into your health and safety planning for controlling COVID-19 in your workplace. Definitely share with your employees, not just via email, but as a webinar, to be clear about what are your requirements and what levels that you require of both hygiene and PPE for your employees and your visitors. I would revisit your planning periodically. As we can see over the last several months, COVID-19 conditions and information changes quickly, and so things need to be reevaluated and revised based on that information. And lastly, I would say post signage in common areas, access areas, some doors, lobbies, things like that, where you have high traffic, and post your messaging for your health and safety culture activities throughout your facility.
And next question is, what is the turnaround time for COVID-19 testing? Florence, do you want to talk about that?
Yes. The PCR run requires multiple wells of controls and standards, so the preparation and actual run, it does take time. Turnaround time is typically 2 days or more, but because there's no culture step, so faster turnaround time, like 1 day, is possible with prior arrangement.
Something else that was asked about the sampling. So when or how often should we be conducting the SARS-CoV-2 surface?
I think this is a very difficult, actually loaded question to ask. So when would you want to sample? It should be based on the risk assessment. If we do use it as a verification of a sanitation, then you should perform sampling after the sanitation. So unless you're doing a survey or a study, we recommend sampling after you have a disinfection, even there's a positive result reported. How often you should conduct sampling would depend on your production schedule or disinfection schedule or the exposure risk, or all of those. For example, if a worker is diagnosed with COVID-19, you probably should expand the disinfection and the sampling more and often. After a consecutive negative result, then you can reduce the sampling frequency. The point is that at least do some testing of high test common areas in order to have a way to verify, and also use this as a way to motivate people to sanitize more thoroughly.
This one came in while Tom was talking, and is kind of related to the question that we just answered. Do we need to sample all food contact surfaces that we normally perform EMP sampling at, or just surfaces employees touch?
Well, that's a good question. Good set of questions there, Jessica. Thank you for the questions that are coming in. I think here it's important to focus on the transmission of the virus is person to person. The transmission of the virus is not food contact surface to person, but as we look at our facilities and what we're doing, what are the risks that you're trying to control? What do you understand about your environment? Have you implemented appropriate controls, PPE, hand sanitizers, and things for frequently touched areas? And then look at focusing your sampling plan on the surface areas where you have direct human-to-human contact or person-to-person contact, as we shared in the presentation.
Keeping with the theme, we got a lot of questions about the sampling. So these swabs are smaller than the sponges we typically use for routine environmental sampling under our EMP. How does the swab size area we can sample, and this is two people's questions put together because they're sort of related, and then how can we sample multiple locations per swab? So essentially, how does the swab size affect the area we can sample, and can we sample multiple locations per swab?
Sure, those are two good questions. Let me take the second question first. You use one swab per surface area that you're sampling. Again, your goal here is to sample frequently touched surfaces. So you don't necessarily want to walk around and use one swab on 10 different doorknobs, because you won't know which doorknob, as an example, was there. So one swab per touch surface is preferred. To the first part of the question about the size of the swab that we're using, that swab actually can sample a surface area up to 100 square centimeters or an 8x8 surface area. And the key with the swab is, as you're looking at the total surface area of the swab, that while you're going back and forth across those areas, you are rotating the swab gently as you're moving through, so that you can use all of the surface area of the swab to get in there. The other thing is that the small size swab allows you to really sample irregular shaped surfaces, such as door handles, keyboards, telephones, things like that, light switches that you're working with. So hopefully we've answered those 2 questions. If there's more questions, certainly we might be able to follow up on those, but very good questions. Thank you.
This one I think would be good for Florence to answer. Is there an air sampling method, or how do we do air sampling?
Thank you, Jessica. That is actually a good question. You know, industrial hygienists, I used to do air sampling. There is a method for sampling virus in air. However, this is very different from what you would use for bacteria and the mold. The regular filter cassette or petri dish will not work because their pore size is much larger than the virus particles. Normally, you would want to use a liquid impinger with a proper medium. And then there's the study I discussed earlier. In their air sample of SARS-CoV-2, they use a brand called the SAS-300 wetted wall air sampler. The flow rate they use is 300 liters per minute, and they sampled 30 minutes. And this study was conducted in the hospital, and the equipment they use, it was special, so they do find a good collection efficiency. So I would, if you plan to do air sampling, I would really look into find a suitable sampler.
Great, thank you. Do we need a special type of sanitizers to kill coronavirus? Tom, do you want to take that one?
Sure, thank you. As far as special type to kill sanitizers, I mentioned in the webinar, their EPA has a list of chemicals that will control or disinfect for coronavirus, and I would recommend that you go there. However, to look at what you have in your facility and you're currently using, perhaps what you already are using is effective, and maybe it's a matter of evaluating the concentration or the frequency of application. Again, make sure you're looking at your risk, the accessibility of your space, the type of surface material that you are trying to control the organism on, as well as the best application method to use. It's just as important to really focus on not just the right sample, the right sanitizer, but the best application method for the area you're trying to control.
Okay, it looks like that's all the time that we have for today. We've received a lot of great questions that we unfortunately don't have time to answer on this webinar. But as I mentioned before, if your question didn't get answered, don't worry. We'll be collecting them all and we'll follow up with everyone individually after the webinar, so you will get an answer. Thank you all again for joining us today, and have a wonderful week.